Hi, my name is Dr. Lisa Kelly. I'm a research psychologist and I suffered with a frozen shoulder for nearly 2.5 years. In that time, I learned a lot about this mysterious disorder. And in this video, I'm going to help you understand this condition so you can advocate for yourself to get the treatment you need to heal faster and with less pain. The first thing I learned is that the real frozen shoulder is not a strain, sprain, tear, or stiffness due to arthritis. The real frozen shoulder is called adhesive capsulitis. Adhesive capsulitis is an inflammatory condition where adhesions or scar tissue develop in the shoulder capsule, resulting in stiffness, pain, and loss of range of motion. Let me pause here for a moment and extend to you my sincere empathy because if you have adhesive capsulitis, it sucks. It hurts a lot, and it is a frustrating and debilitating condition. Adhesive capsulitis affects everything from your work to your sleep to your relationships to your mental and emotional well being. But if it's any consolation, you are not alone. Millions of people are experiencing the same pain and immobility right now. Here are just a few important facts about who gets this disorder. Adhesive capsulitis affects approximately 5% of the adult population. It occurs 1.5 to 2 times more often in women. It occurs most often between the ages of 40 and 60, with an average onset of 55. I was 57. Also, people with cardiovascular disease, diabetes, and thyroid disorders are more likely to develop this condition. 20% of people with diabetes and 10% of people with thyroid disorders will develop adhesive capsulitis. And approximately 15% of people with adhesive capsulitis will get it again in their other shoulder within 5 years. Bummer. The good news, though, is that most people fully recover from adhesive capsulitis within 1 to 3 years. So, what is happening in a shoulder affected by adhesive capsulitis? First, for a variety of reasons that we will discuss later, the shoulder joint capsule becomes inflamed, resulting in pain. The ligaments swell and thicken, resulting in scar tissue or adhesions. The adhesions cause the capsule to contract, resulting in stiffness and restricted movement, and the contraction causes a decrease in lubricating synovial fluid, which results in more pain. Let's take a closer look at some real photos of a normal joint capsule and one affected by adhesive capsulitis. See the red swollen tissue? Ouch! No wonder you feel like crying. Now, how can you be sure this is what you are experiencing? I encourage you to get a professional diagnosis by a knowledgeable MD. They will ask you a number of questions and do some range of motion tests. They might also order some x rays or an MRI to rule out other possible causes of your pain. But while you are waiting to get an appointment, you can evaluate your situation yourself by doing a self check. First, answer these questions. Does your shoulder hurt more at night? Does the pain interfere with your sleep? Does your shoulder hurt more when you lay on it? Does your shoulder hurt with rapid or unguarded movements? Does your shoulder hurt more when you reach the end of your range of motion? If you said yes to these 5 questions, then try these 3 range of motion tests. First, can you raise your arm straight overhead without pain? Second, can you reach behind your back from below to touch between your shoulder blades without pain? Third, can you put both your hands up in the surrender position with the backs of your hands against the wall without pain? If you said yes to the 5 questions and couldn't complete the 3 range of motion tests without pain, then I suggest you get a referral to an orthopedist who specializes in shoulders right now. The sooner the better. Because if you wait, you will begin to experience painful postural compensations, such as an elevated shoulder, resulting in overuse of the scapular muscles, leading to trapezius pain. Finally, if you're like me, you may be wondering what caused this. Unfortunately, there isn't always a clear cut cause. There are two classifications of adhesive capsulitis: primary or idiopathic, which is the majority of cases, which simply means it is a spontaneous condition with no known cause. And then there is secondary, which follows a trauma to the shoulder, such as an injury or surgery. When it comes to idiopathic adhesive capsulitis, we know from the field of mind body medicine that thoughts and emotions produce chemical messengers in our body, and that stressful experiences, such as caring for an ailing parent, trigger a cascade of stress hormones that affect the immune system. When the stress is intense or prolonged, our autoimmune system can become disrupted, and then our body attacks itself. That happens in all kinds of autoimmune disorders, and adhesive capsulitis sure acts like one. But why, you ask, the shoulder? Humans hold a lot of stress tension in our shoulders, upper back, and neck. And remember, having an autoimmune disorder and chronic low grade inflammation to start with makes your chances of developing adhesive capsulitis much higher. So, now that you have a better idea of what is happening to your shoulder and why, I suggest you watch my second video, Frozen Shoulder: How to Fix It. In that video, I describe the stages of adhesive capsulitis, the timeline to healing, and I give you options on how to treat it so you can decrease your pain and heal more quickly. You may also want to watch my third video, Frozen Shoulder: My Experience, where I detail my frozen shoulder healing journey. In conclusion, I just want to encourage you to hang in there. Don't lose hope because help is out there and it does get better.